Um, well, we have some problems with a very tiny fraction of population who take a statin and have adverse effects. But other than that, a statin has been the most uh, safe, the safest and the least problematic medication. So at least there should be talks about that. How to mass adopt a statin, because it's so cheap now. For a whole month, you can get your statin for $5, and it can reduce generically can reduce about 25% of events. So statin in water, it's a radical idea. Could be tested in a population that are very high risk, and just compare putting a statin in water or in food or available to population very readily versus another population, and just study that. I think has enough merit to be studied. But generally, we need to do more for preventive screening, preventive intervention, far more than just raising awareness, what the American Heart Association has been doing for decades. Awareness does not translate into actions, and more needs to be done. Yeah, it was a very exciting idea. Hypothetically, it would work. Practically, unfortunately, with the regulatory system that we have now around drugs and medication and dispensing those medications, it's unlikely. But again, back to statin. Out of those drugs, statin has been the most potent and effective one. So we should just increase the availability of a statin, and also work on people's mindsets. A lot of lay people think a statin is toxic or it kills you, or all kind of nonsense that are on the internet. I think government needs to raise awareness on those, and maybe use some celebrity power, try to educate people. Oh, that's an awesome question. I would absolutely do that. I would, if the studies shown that it can reduce LDL by 60, 70, sometimes 80%. That, by our understanding, can reduce events close to 40 or so percent. If you add them all up, it would be the total number of lives saved would be the range of several wars. And if we just spend 1/10 of what we spend on Iraq war, we can pretty much eliminate heart disease from number 1 to 5th of diseases. So yes, I think we just have to address side effects if there is any. So far hasn't been. It's very easy to use. People want something easy. They don't want to take medication every day, go work out every day, go diet every day. Unfortunately, despite the fact that we know it's the right thing to do, it's not easy to do. So if we can have something like that, or a vaccine, which was a very exciting idea about 20 years ago, still some physicians like Dr. Shah are working on it. But if this hypothetical scenario was possible, I would certainly vote for that. I think we need to do both. An analogy would be like wearing seatbelt. It's not that hard. If we can make a simple medication that people can use, take daily, cheap, like statin, definitely we should provide that to the mass. But we also need to identify those people who are at risk or high risk. In an analogy of driving, put seatbelt, and then also put cops to identify people who are, drunk driver or doing misbehaving. Certain plaques, we know that cause events. Certain patients with a lot of plaques, which fortunately coronary calcium can identify, coronary calcium scoring. So if we are able to do a screening based on coronary calcium scoring, identify those, we should do that. But we should also make available low-cost, mass population preventive measures, such as the statin.